My name is Michael Wallace. I'm a professor of medicine and interventional endoscopist at the Mayo Clinic in Jacksonville, Florida. I'm very pleased to present our paper, which will be published concurrently in Gastrointestinal Endoscopy. The paper is titled Polarization Gating Spectroscopy of Normal Appearing Duodenal Mucosa to Detect Pancreatic Cancer. This is a novel technology that tested the hypothesis that we can detect broad field effects around known cancers with the idea that we can improve our ability to detect early cancers. In this notion of field effect, there is a general feeling that cancers produce changes in the normal appearing tissue around them that can be detectable even if not visible to the naked eye or through an endoscope. In particular, cancers are known to secrete substances that increase blood flow to supply nutrients and oxygen to the tumor. We know this process called angiogenesis, but it's likely more broad than simple angiogenesis. Pancreatic cancer has been particularly difficult to manage. As you know, more than 95% of patients who present with pancreas cancer are not curable at the time of presentation. So there's a major effort to improve our ability to detect early pancreas cancer. We took advantage of this field effect theory to see if we could detect early changes in the duodenum in patients with pancreas cancer in comparison to normal controls. This was a pilot feasibility study in 29 patients, 14 of whom had known pancreas cancer, and 15 were patients who were undergoing upper endoscopy for other reasons, but were known not to have pancreas cancer. Polarization gating spectroscopy is a technique where we measure the light absorption, reflection, and light scattering in the duodenal mucosa. The technique involves passing a small fiber optic probe through the normal endoscope and taking measurements from the duodenum. In the study, we took measurements from 5 different locations, beginning in the duodenal bulb, the first, second, and third portion of the duodenum, and in the periampullary area. The measurement takes about 1 to 2 minutes to do. The actual measurement for each site is almost instantaneous, less than 1 second. The data is stored and was analyzed separately with the investigators blinded to the actual status of the patient. The study was very feasible. It was very easy to obtain the measurements. Again, it took about 1 to 2 minutes to obtain the measurements. And also there were no adverse events associated with the measurement. In fact, the light probe is simply touched against the tissue, activated, and the data acquired in a split second. We then analyzed the data looking at 2 specific parameters: the blood vessel radius, with the idea that blood vessels are dilated through the angiogenic effect, and also the ratio of oxy and deoxyhemoglobin, with the idea that tumors extract a higher proportion of oxygen due to their high metabolic demands. And we specifically had the notion that tumors would be associated with enlargement of the surrounding blood vessels and higher deoxyhemoglobin because of oxygen extraction. And in fact, the hypothesis that we proposed was found to be true. In the study, we found significantly higher proportions of deoxyhemoglobin in cancer patients compared to non-cancer patients or normal controls. We also found significantly higher blood vessel radius in cancer patients compared to normal controls. Overall, the 2 parameters both performed quite well with sensitivities approximately 92%, with a specificity of 86%, particularly with the deoxyhemoglobin measurement. And that was overall the better of the 2 measurements, but both performed well. The combination of the 2 did not provide any additional increment above the deoxyhemoglobin measurement alone. We've now gone on to propose a larger study, and that's an important implication of this study. This was obviously a small feasibility study. The data looks promising, but we need to validate this in a larger multi-center context, and that study is ongoing at the present time. What are the implications otherwise for this study? First of all, it opens this broad notion of field effect change for cancer detection, which may allow a much greater ability to detect early cancers and precancerous lesions. For example, similar work has been done in the colon by the same collaborators at Northwestern University, where they detected field effect changes even around colorectal polyps. In fact, there were field effect changes that extended quite broadly, where even advanced lesions in the right colon could be detected with field effect changes in the rectum. We're now also studying other conditions such as Barrett's esophagus-associated cancer, where we take measurements from as high as the oral buccal mucosa down as deep into the stomach. So the notion that we can detect a field effect around a cancer opens up new possibilities for screening. Now, in this particular case of pancreas cancer, we still had to take measurements from the duodenum, and that still requires an endoscope. But it is certainly easier to do this through a standard endoscope than it is through more complex advanced endoscopic procedures, such as endoscopic ultrasound or ERCP. So it does open the potential to do pancreas cancer screening and evaluation through routine upper endoscopy, which is commonly performed in many patients with upper GI symptoms. So it opens up that area for potential screening. There are also broader implications for this, such that we can add potentially this screening method to other evolving methods for early pancreas cancer detection, including blood-based biomarkers, pancreas juice-based biomarkers, and other advances in cross-sectional imaging, such as CT and MRI. Overall, we found this study to provide compelling preliminary data that suggests that there are broad field effects around known cancers that can be measured remote from the tumor. In this case, pancreas cancers producing changes in otherwise normal appearing duodenal mucosa. We hope to extend this study further with a large prospective multi-center trial currently underway, and if that proves to be also accurate, that this study can provide part of a new armamentarium for pancreatic cancer screening. I want to thank my collaborators, particularly Dr. Vadim Bachman at the Northwestern University, Evanston, also my collaborator, Dr. Mahir Patel, who is at the Cleveland Clinic Foundation currently, and also my partners in endoscopic ultrasound, Dr. Massimo Raimondo and Timothy Woodward, who performed these procedures. Thank you very much.